Hi, my name is Dr. David Shannon, and I'm here to talk to you about root canals. I have a dental practice in Northridge, California, and I find that half the patients that come into my office, out of curiosity, I'll just ask them, do you know what a root canal is? And most people don't. And you could be one of those people that need to have a root canal and don't even know what it is that you need to have. So I want to take a few minutes to explain to you what is a root canal. Or actually, first what I want to do is explain why you might need to have a root canal. So the first thing I'm going to tell you is a little story about a person that I know who was chewing on some ice when it was about 105 degrees this past summer, and they were trying to stay cool without having to be drinking their empty cup that was just filled with ice. So they were crunching away, and they broke a filling in their mouth. And when they broke the filling, they knew they did something wrong. But for some reason, they were just hoping, beyond hope, that it would miraculously heal itself. That somehow it would fix itself and they wouldn't have to go to the dentist. And as you know, never going to happen. So there they were, picking the food after they ate their meals out of their tooth, sucking like that, just trying to get out that little piece of hamburger meat or that extra piece of crunchy French fry that got stuck up in there. And it was just, wasn't going to happen. And what eventually did happen was where that broken filling was, as you can only imagine, a cavity formed. The cavity got bigger, and it got bigger, and it got bigger and bigger and bigger. Eventually, the bacteria that causes the cavity got into the nerve of the tooth. That's when they woke up at 2 o'clock in the morning and said, whoop, I got to go to the dentist. And so they went on the internet, just as you did. They saw my video about the dentist, because I have a whole library, and there's a lot of different ones in there, and you're welcome to look at all of them, by the way. Learn what you need to about your mouth in particular is going on. And they called me up first thing in the morning and said, I got to come in and see the doctor. My tooth hurts. I think I need a root canal. Well, I have a very, very knowledgeable front office staff. They don't do diagnosing over the phone, but she told the patient, you know, it may not be a root canal, don't be worried. I mean, it may just be a cavity. You may just have to have a new filling put in. You may need to have a cap put on your tooth. You may need to have a lot of different things could be without a root canal. Don't be nervous about a root canal. So anyway, he managed to come in and that day, and I took a look at it, and we used an x-ray. We have digital x-rays, and we looked at it right away, and we saw the decay. It was on there, and it was down into the nerve. And once that happens, you do need to have a root canal. And a root canal is caused by bacteria, so one of the main concerns with root canal problems is infections in your body. Now it's not just your tooth you're dealing with. Now you're compromising you. You could become very, very sick. That bacteria can get into your heart. It can go to your liver. It can go to your brain. It can go to all of those places. One of them or all of them. So we want to get you on a course of antibiotics right away. That same day that we see you and we treat you. So there's antibiotic therapy that's needed. Of course, don't forget, if you've got allergies, you need to tell us which ones you can't take, because the dentist needs to know that information too. It's very important. But once we diagnose a root canal, I've actually had patients that have said to me, so in a root canal, do you take the root out? No, a root canal, taking the root out is extracting a tooth. It's pulling your tooth out. That's what the tooth is the root. We don't want to do that. We want to save it. So a root canal is really a very simple process, and I want to explain to you what it is, because until you have a cavity that goes into the nerve of your tooth, until you have a broken tooth that cracks off into the nerve, you may have never even dreamed of having a root canal in your mouth. This is, like with most people, a once-in-a-lifetime situation. So we're going to discuss what it is, so you know what this once-in-a-lifetime situation is. So picture in your backyard you have a pipe that's running through your yard, and in the pipe are electrical wires. And they're attached to a switch over here and a beautiful fountain back over here somewhere. A gorgeous fountain. So you flip your switch over here, it's like a miracle. And all the way over there, the fountain turns on. Well, picture that underground pipe with the wires in it. Now, picture your root. It's the same thing. Now you've got this pain up in the jaw at one end, and you've got this hole down in the other end. Well, the hole is like the switch that's making the pain, like the fountain, turn on up here, and that's the pipe underneath there. So the root is a hollow pipe that the wire's no longer working. So what are we going to do? Well, the proper thing to do is not ignore it. If you decide you don't want your fountain anymore, you just don't take the switch off the wall and walk away and say, okay, I don't have a fountain anymore, because you know what? That pipe is going to fill up with mice are going to want to live in there. They're going to make little nests in there. You're going to have rats that live outside. They're going to want to live in there. And you're going to have all kinds of crawly bugs in there that are going to want to live in there. So there's a lot of things that could live in that pipe. Well, there's a lot of things that can live in your root of the tooth as well. So what we're going to do is we're going to clean out and wash out all of those wires and all of the bugs that are living in there and all the things that are in there that are in the root. And after it's cleaned out and you're on the antibiotics so that you're not having problems with the rest of your body and we know everything is under control, and what we're going to do is we're going to take a rubberized cement and we're going to fill it up into that root so it's totally sealed. Just like you would run cement in the pipe in the ground and seal it off because you don't want to use the fountain anymore and you don't have the switch anymore. It's the same concept. So that's what we're going to do in your tooth. Now, if the tooth broke, if the cavity was big, we've saved the root. What's the advantage of saving the root? At that point, we have to do something with the tooth. So we have to put usually a cap or a new tooth, over that root, in order to make it look and feel and work like all the other teeth in your mouth. So it's not just a root canal. If you're going to have a root canal, it doesn't end with the root canal. The tooth has to be fixed. So a lot of times we put a little post in there to help give it some support. Sometimes we put a little screw in there. And then we put a cap or a new tooth over where the old decayed or cracked broken tooth was. And that's really an advantage, because if you watch my video on implants, if we've taken the root out, we're going to take a metal screw and we're going to put it in there to act like a root. Well, before we put that in to act like a root, why not use a root? Because a root is better as a root than a not a root to be a root. And that's what I'm rooting for, whatever. Okay? So the whole idea is we want to keep what we can keep in our mouths that belongs to us, that's ours, that's put there by nature, that lasts if it's taken care of, and if there's a problem with it, we can do a root canal on it and we can save it and we can keep it for the rest of our lives so that we have a proper smile, so that we have a healthy mouth, so that we have no infection, we have no bacteria, we have nothing else to deal with except to smile and be happy and to realize that we are in control of our $1 million smile and we don't have to spend $1 million to get there. So I'm Dr. David Shannon. I'm here in Northridge, California. Give us a call. Come down. That toothache you're having, even though it's not waking you up at night, it's a root canal waiting to happen. Don't let it happen. Thank you.